Okay, well, this is Mark Gonzalez, presentation over the Cuban culture and general overview for nursing considerations when caring for someone of Cuban descent. So to begin, understanding where the Cuban population is, it's now reached over 2 million people. More of them continue to migrate to the United States. Dense populations in the northern U.S., such as New York, and in southeastern, like Florida. Um, so in order to be able to provide for anyone from Cuban descent, we have to be able to adapt to their needs and implement those nursing considerations in order to provide care for the client as a whole. Um, so to begin with that, you have to understand the health risk factors that are associated with the Cuban culture. Cardiovascular disease has been identified as the leading cause of death among Cubans, both in Cuba and the Cuban Americans within the United States. So a lot of them have been here for 20, 30 years when there was a big migration from Cuba, and so now we're starting to understand a lot more of those things and their health risk factors because Cuba was so closed for a while. Hyperlipidemia continues to increase within this population due to their custom diet high in fatty foods. So their diet usually consists of rice, beans, and fatty foods. It's been a staple in their culture, and it's something to educate the patient on if they're suffering from some kind of cardiovascular disease or other related disease processes. Obesity continues to rise among the younger Cuban population, that is both here and in Cuba, with them coming over and being more or having fast food more readily available to them, and just the social economic factors that come into play with them coming here, migrating here. It's easier for them to access those foods, and so that goes again with the nutritional education that is very important. Hypertension is common among the Cuban population. That's one that goes along with cardiovascular disease, coronary artery disease. So education again is very important for that. Now with hypertension, it has seen a slight decrease among the years, and that is because one interesting fact I found is 3.6 times more apt to accept health changes to improve overall health, and that includes accepting modern medication. With Cuba being more open now, there has been more of a clinic outreach, health outreach to the rural areas, and so pharmacological means of preventative care are available to them, and they are open to it, and so that's good. An increase of healthcare in rural Cuba has led to moving and accepting pharmacological means of improving health. However, with that being said, home remedies still remain the primary source of healthcare for many. For example, tea for curing hot tea for curing a cold. That still remains important to them, being able to take care of their family member at home. Um, with that being said, at home, gender roles play a big part in the root Cuban culture. The mother often assumes the role of the caregiver, while the father will make the decisions based on the mother's assessment. So typically, the mother will decide when, for example, one of their children will need medical care. The father is typically the one that will go and take the child or take the family in order to look for that care. Uh, Now, if it's a long-term decision for healthcare, often the whole family is involved. They do like the opinions of their family, the support, and so caring for the needs of the family is as important as the needs of the client. So involving the entire family with privacy, of course, you have to ask the client if it's okay, but to understand, how much you can disclose to the family. Um, and then allowing the client's family time to address their needs. A lot of times they like to have a lot of the family there present with them. So just allowing them that privacy with their, with the client that's sick is important. Um, Poor diet remains a problem for many households. Again, that goes back to the diet, the fatty foods that they like to eat. Their meals are typically large. They have a lot of family over, and so education for that is necessary. Habits such as tobacco show no sign of decline among this population. We've all heard of Cuban cigars. It's very, very common there. As you can see, 40% of young men use daily, and 60% of middle-aged to elderly men use daily. There's no decrease in the elderly use of tobacco. And so you combine that with a lack of physical activity, and it attributes to those obesity rates. Those habits are likely not to change. However, it is important to provide the education for smoking cessation and the likes. Whether the client accepts it or not, it's still important to provide that for them. So, in conclusion, Cuban Americans have many similar characteristics to other Hispanic minorities. They do, such as speaking Spanish. Most are well educated. They still remain the fastest growing minority in the southeastern region of the U.S. Nursing considerations must be maintained in order to provide the quality care necessary for health improvement. So, understanding Cuban culture as a whole and how their families play an important role in their health and well-being, those nursing considerations can be implemented in order to get that necessary health improvement. So knowing those health risks that they have, we can better educate them and lead them towards better health.